Christy Axmaker, Comm 111, Informative Speech. Imagine being 12 years old, running, playing, going to school, thinking you have enough energy to conquer the world. And then one day you get a tummy ache. Doesn't seem so bad at first, but then it gets worse. By the following week, you're in bed all day long. Mom thinks at first you're just whining and complaining, maybe looking for attention. And then she thinks maybe you might have the flu. At this point, you're going to the bathroom up to 30 times a day and feeling really, really miserable. And then you notice that you have blood every time you go to the bathroom. You don't want to tell anybody because you're 12 years old. And because your 13th birthday is right around the corner and you know that Mom will never let you have a party if you're sick. So about a week later, you finally decide to tell somebody about the blood. Well, Mom goes into general panic, and the next day you're at the doctor's office and then the hospital. This is the beginning of my daughter's story. And later we will learn that she has ulcerative colitis. For the purposes of this talk, I'd like to call it UC. I'd like to teach you a little bit about UC and help you understand the signs and symptoms, treatments, diagnosis, prognosis, and psychological effects for the child and their families. Parents of children age 8 to 18, please be aware that chronic complaining can be a cry for more medical attention. So let's start with what is UC. It's a chronic, lifelong illness with no cure at this time. It is the inflammation of the large intestine which causes ulcers and lots of other things. This is a picture of a very unhealthy colon that has ulcerative colitis. The signs and symptoms of ulcerative colitis are ulcers and pain, bloody stools, abdominal cramping, loss of appetite and weight, fatigue, anemia, fever, and diarrhea up to 50 times a day. The people that are most at risk are those that are immunosuppressed, women on birth control, people with a family history of digestive disorders, and the fourth category, spontaneous presentation in children. My daughter falls into this category. At this point, she had lost 20 pounds and had stopped all extracurricular activities and was going to the bathroom up to 30 times a day. We needed some answers. So we began looking at how to find a diagnosis. Diagnosis is very difficult for ulcerative colitis, and it's diagnosed usually between the ages of 15 and 35. It's most common in males, Jews, and whites. And the next thing that they do is try to find what's wrong with a person by collecting stool samples and blood samples, colonoscopy with biopsy, liver function tests, and ultrasound. My daughter had her first colonoscopy shortly after her 13th birthday. The prognosis for this illness is also quite dismal. There's a high risk of cancer, peritonitis, perforation of the colon, and 33% of all sufferers choose colon removal by the time they're done with this disease. But there is hope on this end of things. Herbal supplementation and alternative medicine have really given the sufferer hope. We have found a doctor, Dr. Jordan Rubin, that talks about alternative medicine and lifestyle change and diet reformation, Patient Heal Thyself, and Restoring Your Digestive Health are two books that we've found a lot of really good information in about all kinds of digestive disorders, not only ulcerative colitis. The typical treatments for ulcerative colitis include drug therapy, hospitalization, and finally the colon surgery for colon removal. My daughter went through drug therapy and hospitalization without any success whatsoever. So that's why we were so looking forward to finding another answer, and that's why diet reformation and lifestyle change looked like a really good idea to us before we had to head into surgery. Now, the last thing I'd like to talk about is the psychological effects of ulcerative colitis. Stress and depression are the biggest problems, and as you can imagine, teenagers and children as young as 8 years old really suffer from these things. Although ulcerative colitis is a serious chronic illness, it is not considered fatal unless it is left untreated. My daughter's managed ulcerative colitis successfully for 3 years and has been in remission for 2 years. Now, we've talked about a lot of things. We've talked about signs and symptoms, the diagnosis, prognosis, typical treatments, and psychological effects. But the thing I want you to remember the most is, for parents, please watch your children for chronic complaining. If it turns out to be something a little bit more serious, please take them in for medical attention. Research is being done to advance our knowledge and improve health every day. With proper medical care and the involvement of the individual in stress relief and diet reformation, there is hope for a completely normal life. My daughter is a perfect example of living happily with UC.